Hello, Dallas. Hello, everyone. And very good morning to Dallas, and good evening to Dubai, and also good night or good late evening to India, and on good afternoon to some part of my global viewers. Thank you so much for joining today, and thank you for being part of this one. Welcome to my show, Global Gupshup. This is a Asia News presentation, and I'm your host Anu Benekati, taking every one of you on an exciting journey with me to meet extraordinary guests on every episode. So please be ready. Today also we have a very special guest. Friends, in few of my previous episodes, if you have watched, I have had an opportunity to talk about many different aspects of Ayurveda. So Ayurveda itself is an amazing word, and Ayurvedic medicine has a rich history, as we all know, and it's universally accepted and recognized, this traditional system of medicine. This 5,000-year-old medicine actually is a natural system of medicine that originated in India. The term Ayurveda is originally from Sanskrit, meaning medicine of life. This holistic medicine specifically concentrates on preventive measures and understanding the balance between mind, body, and spirit, which can be achieved very highly through proper diet and exercise, along with yoga and meditation to fit one's lifestyle. So basically, it can be tailored to the individual need. So evidently, many discomforts and diseases can be eliminated and healed through this amazing scientific knowledge and treatment. Today, I'm about to discuss one of the conditions most women will have to go through at some point of their life, and especially in midlife, should say, but are very not very comfortable to talk about it. It's very sensitive and embarrassing sometimes, and it is the process called menopause. I'm sure we all have heard it, which will cause minor to severe discomfort, hot flashes, night sweats, and whatnot. So but however, like how properly that, if we understand it, or understanding of the phase, that can give us a great help, and also to help to take a better care of ourselves. And today is all about find out how Ayurveda can help in doing so. Today, currently, we have a very special guest in our studio, and she's an Ayurvedic physician who has treated more than 5,000 patients with her expertise. Currently, she's working as a medical director and chief consultant at Sri Sri Tattva Panchakarma Ayurveda Center, a branch of Global Brand, as an initiative of Art of Living. She completed her BMS, which is Ayurveda medicine, at Ayurveda Mahavidyalaya, Hubli, Karnataka, and PG diploma in yoga studies from Karnataka University, Dharwad itself. She specializes in Varmakalai, studied under Dr. Shanmugam from Tirumala Pharmacology Institute of Coimbatore. She's also a certified pranic healer. The pranic is a very specific word. It means prana, which we all know about it. And she is going to talk a little bit about that as well. So how it plays in the most important role in our life. She has over 25 years of experience as a physician practicing Ayurveda in India as well as in UAE, United Arab Emirates, and received a Certificate of Appreciation Award. It is a very honorable award from His Excellency Dr. Amin Al Amir, Under Secretary of Medical Offices of Health UAE, for outstanding heads of ensures in selection of a competent and reliable healthcare professionals. So she is the founding member and former president of Emirates Ayurveda Graduates Association. It's referred as a EAGA UAE, and also she served as the convener of scientific committee of the first Ayush International Conference held in World Trade Center, Dubai in 2017. Conducted many breast cancer awareness in Indian consulate and in Dubai prisons as her service, and also in ladies' labor camps in Sharjah. She is specialized in pulse diagnosis, pharma therapy, panchakarma, and her focus is in treating women hormonal health in holistic approach, especially in preconception detox for natural, fertility, non-invasive pain, and management in IVDP, that what we heard as an invertebral, disc prolapse, and holistic management of mental health with Ayurveda and yoga. So we are very excited to invite her to the show. Without further ado, I would like to invite and welcome Dr. Mamta Suresh Redder to the show. Thank you so much for joining. It's a pleasure having you here in the studio. How are you?
I'm good. Namaste to viewers, and thank you, Anu, for calling me on Global Gupshup. Let us
Thank you
discuss
so
about
much.
women's health. Yeah,
Absolutely, it's pleasure having you. We are all excited because some of the topics are very sensitive, extremely, like emotional, as well as not comfortable to talk about. So today, I
yes,
think we are going to explore a little bit about it, so that we are going to cross that comfort zone and then go reach out to viewers and who has gone through or who is going through such situation at this point. So it's my request to all the viewers, if you have any questions, do not hesitate. Please go ahead and post it on your Facebook or YouTube. It's watching live, and we will try our best to address those questions once, like at the end of the this short question answer session. So I think it could be, like menopause. I know it is very painful, it's discomfort. On top of that, somehow I feel it could be a start of a rewarding chapter, because it's kind of like, lowering some kind of a health risk, even though it
yes,
increases some of it. So I think we have both sides of this menopause. It's not just a something that we need to think very negative about. But so talking about that, will you please share some of the details about, like, how what it really saves us from, or what exactly is goes on during this phase in women's midlife? So with our viewers, before we
yes,
start our question and answer session.
yes, Anu. When we speak about women's health, we understand that it encompasses many different phases
Mhm,
during the different stages of life.
mhm,
Every woman goes through a series of profound changes during her lifetime. The
right.
primary changes are called like menarche, pregnancy, postpartum, and menopause.
Mhm,
Today we will speak about menopause.
mhm,
According to Ayurveda angle, menopause doesn't mean only the hormonal changes. It has its own unique language and terms. Prakriti is a genetically determined categorization of the population into several subgroups on phenotypic characters like appearance,
mhm,
temperament, and habits. We all know about Vata constitution, Vata body type, Pitta body type, Kapha body type.
mhm,
We understand that. Many of you know about it. But hormones are considered in Ayurveda as Dhatvagni. It's a
mhm,
fire element in your tissue that aids in the transformation of nourishment to the tissues. They are carried by the blood, therefore, they are considered as a component of Pitta, the fire element in you. So, because earlier you had Ayurveda talks,
mhm,
let me just introduce what is Prakriti
mhm,
and what are the Vata Pitta Kapha.
mhm.
See, we all believe in
Mhm.
Ayurveda, we all believe of five elements.
Right.
These five elements exist in our body in the subtler bioenergy forms called
Mhm,
Vata, Pitta, Kapha. Vata is mainly air and space element.
mhm.
Pitta is the fire element. Kapha is the earth and water element.
Okay.
So, Vata is the energy of movement.
Mhm,
Anything moves in the body is
mhm,
because of Vata. Your nervous system, your assimilation, your locomotor system, your thought process, and whether it is your menstrual periods coming at right time, everything is managed by Vata. And when I speak about Pitta, it is the energy of transformation. Anything comes in contact with fire, it gets transformed. The same way in body, the digestion, the hormonal system, metabolism, your intellect, everything, your vision, everything is managed by Pitta.
Okay.
And when I talk about Kapha, I call it as an energy of cohesion,
Mhm.
building up of blocks because it is an earth element.
Mhm.
So your body growth and bones and the mucus secretion, your immunity, your sense of grounding, feeling kind, compassion, your memory, everything is managed by kapha.
Okay.
When we are in the balanced state of all these elements, all these bioenergies, your health is there.
Mhm.
So when there is an imbalance in these, we have diseases. Okay,
Okay. Mhm.
disharmony is a disease in Ayurveda. So when it comes to women's health, we undergo three stages of life.
Mhm.
In the Kapha period, that is the childhood period when you all are growing up and you have those changes appearing in your body. That is the time of building up of blocks. When it comes to the Pitta stage, that is from menarche to till your fertility age, that is the time it is Pitta time. That
Okay.
is up to 40 years, maybe more than that. We will all have the Pitta stage. We have so much to do with our careers, our family matters, giving birth to children, progeny. Everything happens in the Pitta period.
Right.
As we move on to menarche to menopause, that is the period of Vata.
Mhm.
So you're going into the stage of Vata where you start feeling some changes in your body. There are hormonal changes, and you start feeling, emotionally, mood swings will be there, and there will be frizzy hair,
Mhm.
dry hair, dryness of skin, all these appear.
Mhm.
So, according to Ayurveda, menopause is not just the cessation of periods in
Mhm.
women's life, it is the period of creativity.
Oh,
Vata is also known for creativity and
okay.
spirituality. You're gracefully aging towards the
Spirit.
menopause or
Mhm.
towards the spirituality.
Okay.
That is menopause according to Ayurveda.
Okay.
So, to understand these Prakriti variations,
Mhm.
I'll just give an example. If a Pitta type of woman eats plenty of spicy food and she keeps on including the activities which are Pitta aggravating in nature, like, taking hot baths
Mhm.
or moving around in the sun, huh? Getting angry too much. So then she will aggravate the Pitta in the blood. So suppose this can cause excessive bleeding in a woman,
Mhm.
and you have those premenstrual PMS symptoms like mood swings, bloating, all those symptoms
Wow.
come when there is a pitta imbalance.
Mhm.
Suppose after the age of 40, the body
Mhm.
begins to move towards vata, as I said.
Mhm.
So if you start indulging in the vata type of activities, you are not sleeping well and you are doing lot of activity mentally, physically. So then there is an excessive vata in your body. So
Right.
what happens? You start having a scanty menstruation. You start feeling the dryness in your body. You
Mhm.
start feeling the dryness in hair, and you start feeling the dryness in the vaginal mucosa as well.
Mhm.
And in the perimenopausal stage, you may have scanty menstruation as well. Hmm? And in the same way, when kapha type of personality who indulge in lot of intake of sweet food and not doing any activities, doing the sedentary lifestyle,
Mhm.
then she starts feeling the heaviness in the body. She will have more bleeding, like, she'll be having clots in the bleeding, and she may end up in the menorrhagia. She may have fibroids. She may have engorgement, pain, breast pain. These all things develop in the kapha type of woman. I hope you understood the prakriti and how body behaves to these uh, imbalance, the lifestyle what we follow, how the changes happen in the body. This
Right.
is the menopause according to Ayurveda.
Okay. So we will start with a few of the questions that probably in relevance to all these, like what you did say a few things about, like let's go a little bit of a in detail, like what exactly is perimenopause,
Yeah.
and how important is it for a woman to have a preventive checkups during,
Mm.
especially during this time. So
Yeah.
and so if you can just.
So, woman undergoes menopause from the age of 45 to 55 years, right?
Mhm.
So, consider ideally by 50, 51 women attain menopause.
Right.
Okay.
Mhm.
The transition between the period of menopause, before the menopause
Mhm.
and after the menopause 1 year, is known as perimenopausal
Okay.
time.
Mhm.
Okay, this time women undergoes lot of hormonal changes.
Okay.
What happens is there is a ovarian reservoir. It
Right.
is, we all know about it, and so there will be a depletion of that,
Mhm.
and there starts the changes of hormones happening in the body.
Okay.
So that time the estrogen progesterone levels start lowering. So this is the period when women start developing some symptoms and signs, like they may be having hot flushes,
Right.
some have night sweats. The period starts becoming heavier for some. For some it may be short periods, frequent short periods they start getting. And for some there is a mood swing, for some there is an irritability, some start gaining weight, and
Right.
then they have a lot of breast tenderness and all.
Mhm.
So
Mhm.
these are the symptoms when women enter the perimenopausal stage.
Okay.
So what are the things we need to take care? So we always have to women over the age of 40 years.
Mhm.
So they should always consider about their breast health and uterus health.
Okay.
Yeah. So
Mhm.
clinical examination regularly with a gynecologist or a GP should be done,
Mhm.
and we need to check our breasts every year.
Mhm.
And simple technique is examining self breast examination every month
Mhm.
during the periods. It is very important so that it can be easily remembered and done every month. So you will be the best guide to know what changes are happening in your breast, right?
You'll understand better. Mhm.
Yeah. So that is according to self examination.
Okay.
And when it comes to clinically, you can get it tested, and you can have yearly checkups of your lipids, your thyroid levels, because there is so many hormonal changes are happening in your body. So
Right.
you need to take care of that. So check your thyroid levels,
Mm.
and if possible, check your lipid profiles. This is very important during the perimenopausal stage. Also, uh, you can check, sometimes bone density starts going down as we enter into menopause.
Right.
So that also has to be taken care during the perimenopausal stage
Preventive care.
as
Okay.
a preventive measure. And you can have the pap smear tests regularly,
Mhm.
at least once you start having the symptoms. If you have menorrhagia and if you have intermenstrual bleedings, so then that is the time you need to get your checkups done regularly in
Okay.
the perimenopause stage as well.
Right, right, right. Okay. Well, thank you. Also, like I know that a lot of us will not pay attention to this one. I know that the physical symptoms are visible, and we also actually, witness it and experience it. And the most critical one are the emotional, because during menopause, I think the emotional, variation. That's like what you just mentioned. That the anger or stress,
Mm.
anxiety, and many kind of things that just automatically go out of control. So is this going to be harmful, and then how they can control, and is there any ayurvedic way to control their emotional stress, so that, like what you said, so that we can just not reach or aggravate the pitta level.
So for this, I would like to introduce,
Hmm.
what the type of people, how they go through the symptoms, emotional symptoms. Yeah.
Hmm. Hmm.
And then we'll go to the pitta type of people, how they feel, how we
Okay.
can correct through the lifestyle,
Okay.
right?
Okay.
So usually in vata type of personality, they start feeling nervous, they start feeling anxious about everything. They
Hmm.
have a lot of mood swings,
Hmm.
and sometimes there is a insomnia, you know,
Hmm.
sleep
That's a good
disorders
question.
they have.
Right.
So this is the thing,
Mhm.
why these all things happen at this time is before during the pitta period. I would like to explain this. During the pitta period, you're so busy doing your career, and you're so busy taking care of your kids, studies, everything. And at this level, your kids, they enter into the colleges,
Right.
and there's enough time with you, and you will never concentrated on this time.
Hmm.
But there is a vacuum created in your life, even your spouse is busy in doing so many things. He needs to arrange for the kids education, for the future, everything he's looking after. So there is a gap in, vacuum created in your life. So many women, if they're house homemakers, I would rather say they have enough time and they are feeling that everybody is not caring. This is
Uh-huh.
the psychological effect what the
Women.
um, women face.
Right.
Many of them face. So at this time, they start feeling more left
Hmm.
alone,
Hmm.
and that sadness is there. So they
Hmm.
feel sometimes nervous, sometimes they feel anxious. Yeah.
Hmm.
And I've seen many women come to me with a history of, even though they were so confident enough and they're so creative enough, even the working women, they say at this time they feel suddenly there is a mood swings, there is
Hmm.
suddenly a sadness, there is suddenly an anxiety in them,
Right.
right?
Right.
So these things happen,
Hmm.
and it is not that it's only just homemakers, every woman face this,
Correct.
right?
Yes. Hmm.
So, and if you are feeling this kind of changes in your psychological aspect during the, if you are a Vata type of person, then watch out your diet, what you're eating, and watch out your activities. So, what I say is increase warm foods, calming type of food,
Hmm.
and don't indulge in heavy meals. Have try to have light meal, and don't indulge in lot of raw salads during the night time, especially vata type of people. Just try to have warm soups, stir fry vegetables, and easily digestible food like khichdi
Hmm.
or rice. This kind of food will calm you down,
Hmm.
and then avoid having lot of mm, very spicy food. You can
Right.
go for fennel, cumin,
Hmm.
coriander, these spices, if you include in your diet, that
Hmm.
will help you.
Right.
Other than that, you can have a chamomile tea as well, which calms you down.
Okay.
And for Vata type of people, what I always advise is just try to, because their mind is always so
Busy.
moving, and a lot of thoughts, always busy doing multiple tasks, all that will be there. Slow down, okay? Take a break and go early to bed and have a good
Good
sleep.
answer. Right.
Yeah. And then, so since the dryness is increasing, what I suggest is doing self abhenga for your own self.
Hmm. Hmm.
Remember that skin is the biggest organ on our body. When
Hmm.
we pamper ourselves, there is a happy hormones released in our body. We can give 15 minutes of everyday massage.
Hmm.
That will help them to calm down and feel grounded. When you start about yoga, when I speak about, they should do grounding kind of exercises, and they're more prone for the, uh, you know, joint pains,
Okay.
body ache, all those things. So this also helps for that. And then they should take care of their calcium levels as well.
Mhm.
And this is very important in Vata type of personalities. And when I speak about
Mhm.
Pitta type of menopause, when it
Mhm.
comes to psychological beings,
Right.
they have irritability,
Mhm.
anger, okay, and sometimes they feel they may get panic attacks as well
Oh wow.
when
Mm.
there is a lot of this thing. They have a lot of hot flushes, and they may be having excessive bleeding, and
Mhm.
they may be having skin rashes.
Right.
Sometimes they're prone for more of urinary tract infections, which is
Mhm.
during the menopause. Many women face cystitis and all these things. So in these people, they need to add cooling food. Okay,
Mhm.
they should start avoiding spicy food, fried food, junk food, and all
Mhm.
these frizzy drinks. They need to start avoiding.
Right.
Stop smoking or stop alcohol, which will increase their pitta. So they should do these things, and they should have sweet fruits, no, like
Mhm.
apples, mango,
Mhm.
melons, and yellow squash. All those things help them.
Mhm.
And apart from that, for them also, fennel tea, chamomile tea,
Mhm.
licorice, these
Mhm.
teas help them to calm them down.
Okay.
And when it comes to sleep pattern, they should go to sleep by 10 o'clock,
Mhm.
reduce their screen time, okay?
Mhm. Mhm.
Uh, and as well as they should do the massage with coconut oil.
Okay.
Vata people can use sesame oil or Vata calming oils you get. Pitta
Mhm.
people can use coconut
Okay.
oil, which is very calming. And apart from that, they should do meditation. They should start practicing meditation.
Okay.
And they should do the pranayamas, which help them to calm down,
Mm.
especially Sheetali and alternate nostril breathing, what we
Mhm.
call Anuloma Viloma,
Mhm.
Bhramari. All these help to calm them down.
Mhm.
And there are some herbs like Shatavari which can help them to get in control of their pitta. Okay,
Mhm.
that helps. Sandalwood.
Mhm.
Then there is berries also help them.
Mhm.
Hmm? So
Mhm.
this kind of uh, pitta type of psychological uh, issues we can handle. When it comes to kapha type of people, what happens
Mhm.
is they have lot of weight gain. So they
Mhm.
start feeling sad, and they feel like left kind of left alone. They start feeling depressed. All these psychological symptoms come to them. You know
Yes.
So that time, sometimes they may indulge in eating sweets, pacifying themselves with these things. So at that time, what I suggest is these people should start having light, warm
Me.
food, okay,
Mhm.
and
Mhm.
frequent meals they can take.
Mhm.
Whole grain and more of vegetables, leafy vegetables they can use.
Mhm. Mhm.
And they can use spices like black pepper, turmeric, ginger. All this will help them.
Okay.
And avoid taking more of milk products, that makes them lazy, sweets. These things are not good for kapha type of people. So what I tell them is reduce cheese, reduce cold drinks, all these things in food you take care. When it comes to lifestyle,
Mhm.
usually they should practice dinacharya, what we call. They should
Mhm.
get up early,
Right.
getting early.
Right.
It plays an important role,
Important. Right.
and they can be recommended
Mhm.
more of dry kind of brushing on their body. And if they want to do the massage, it's better to do with mustard oil, which is heaty in nature, and then that makes them feel good. Okay,
Mhm. Mhm.
that is one thing. And for them, the herbs like cayenne, gugulu, myrrh, all these things help them to have a uh, what I can say. effortless sail through this process.
Right,
Yeah.
right, right. Well, thank you. That was a great advice for as far as the nutrition is also concerned, and also like what to eat and what not to eat. So, let's go ahead and take a short break, and then we'll come back and talk more about like the changing, the hormone levels and the other like what medication effects and all that. How we can manage through Ayurveda to feel better during this phase. We'll be right back. Welcome back. And this is Anu Benikati and Global Gupshup. Today is we are discussing with a physician, Ayurvedic physician, with a very, the most, uncomfortable, I should say, the topic that many women don't want to talk about is the menopause. And we are actually exploring the Ayurvedic way to feel better and, make ourselves comfortable during the discomfort that every woman go through. Well, thank you so much, Dr. Mamta. You have been a great help, and discussing all these topics that what we are going to have next. Also, my next question is. Like I know that a lot of us also have a little bit of a hard time believing, but are there any so-called the simple home remedies that like that when it starts then we can immediately just say that okay, just do this one and then it can really give you a relief, and then we'll see what happens. So are there any such home remedies that you would recommend during this time?
Yeah, as I suggested, one is the food, what pattern they have to follow.
Mm-hmm,
See, suppose if you have irritability and there is a lot of water retention, all those symptoms you get, right?
mm-hmm,
So
mm-hmm,
watch out your diet, and then you can go on the fennel. I usually advise my patients to have CCFT,
mm-hmm,
that is cumin, coriander, and fennel seed tea, which helps them to feel lighter. Okay. So suppose if you're feeling very heavy and not able to move around, then you go on ginger tea, which
mm-hmm,
helps to feel you good. Okay. That can be managed as a home remedy.
mm-hmm.
Suppose uh, if you feel a lot of mood swings and all, then shatavari is the herb which helps you. And other than that, we will talk about phytoestrogens as well, so which are plant-based estrogen help for women.
Mhm,
So in that there are nuts, seeds. So you can have flax seeds, you can have sunflower seeds. All these things help you to manage your hormonal imbalance. And apart from that, as I spoke about yoga,
mhm,
so try to do grounding exercises. And for all my patients, I say, even if you haven't exercised before your menopausal or perimenopause symptoms start, this is the time you take up your time for at least half an hour of exercise in your life to maintain your bone health. Until we have female hormones with us, we are
mhm.
not, we are lucky enough to have proper bone
Right,
health, and then your cholesterol is all managed. But
right,
when
right.
you enter into the menopausal or perimenopausal stage where there is a hormonal imbalance, you are more prone for less of bone density and this one. Also, you can develop cholesterol, you can
Right.
develop CVDs. In this case, what I advise all my patients is you can add up in your diet the super herbs, wonder herbs, what we call superfood,
Mhm.
drumsticks.
Right.
Drumstick leaves has good amount of calcium, vitamin D, and
Oh,
proteins, all that, that can be added in your
that-
diet. Other than that, you can add sesame seeds.
Mhm,
Sesame is in Ayurveda, what we say is a complete food for a woman to
mhm.
have healthy hair, healthy
Oh,
skin, healthy bones, and healthy hormonal health.
that's awesome.
So you need to include sesame seeds
That's what I
in your
see.
diet. Yeah,
Absolutely. Absolutely. Well, that reminded me of just to follow up that question is uh, I know that this is all just in healthy women that, even if we have a minor here and there issues, but is this going to be a challenging for women who are already like facing difficult situations and health conditions like diabetes, high cholesterol, or maybe even a cancer survivor? Or on specific medications, do you think that will affect tremendously?
yeah, definitely it will affect
Mm-hmm.
during the menopause because there are a lot of hormonal changes happening in the body. This transition takes 4 to 8 years for an average woman
Okay.
to undergo into the cessation of menopause. So, in this period, if you are cancer survivors,
Mm-hmm.
so it depends on the what kind of cancer they had
Mm-hmm.
and what medication or whether they went on radiation therapy or it was uh, other cancers, then they need to have watch out their diet, and more than that, they can do the Ayurveda detox therapies as well,
Mm-hmm. Mm-hmm. So
so
that
which
will help.
help them. So in our institution, Shri Tattva,
Mm-hmm.
we manage the cancer patients in 4 stages. So we
Okay.
have a separate unit for that in Bangalore.
Mm-hmm.
Like, post cancer survivors, we have a protocol which we follow.
Mm-hmm.
Other than that, pre-cancerous, and then some cancers which are untreatable. In
Sure.
that stage also, we can do panchakarma.
Mm-hmm.
All that can be managed. If you
Right.
are diabetic, watch out your sugar levels.
Mm-hmm.
And usually, cholesterol levels, if they are high, we need to manage our diet, lifestyle, and include healthy exercise habits.
On
All
the
that has to be managed.
right. Well, I'm going to come to a very, I think that's in all my audience probably are going to love this question too, because I know many of us go through this with or without a menopause. But one of the most concerning issues is weight gain as we speak. And does Ayurveda has any specific remedy to control or even just, to help to lose few pounds that you actually, whether it is a menopause or post or, like menopausal things that we actually go through. So, is there a way that it can help?
Yeah, it will help. We can do in Ayurveda actually. So
Okay.
it is all, in Ayurveda we have therapies called Panchakarma,
Uh,
right? 5 detox therapies
right,
we have.
right, right.
Apart from that, when you go to any Ayurveda doctor or
Mhm,
when you consult your Ayurveda doctor, they do your analysis and they advise you the diet. So
mhm,
in weight gain, it is mainly not just because of your eating habits. There are hormonal changes happening in your body where there is estrogen surge, then you're gaining more weight. Hmm?
mhm.
So in that case, what you need to do is step by step, you need to follow the diet pattern. And we say that you need to follow a daily routine. In
Mhm.
Ayurveda, we call it as dinacharya.
Right.
Okay.
Mhm.
So in that, we advise is waking up early in the morning in the Vata period, not in the Kapha period, before 6 o'clock,
Okay.
and doing the exercises
Right.
and following the daily routines.
Mhm,
That helps a person to be, sleeping at right time. This
mhm,
all matters, and
mhm,
you need to fine tune yourself to the nature,
mhm,
the sun cycle and the moon cycle. So then you will feel much better in
mhm.
your health. So in the diet, what we say is try to avoid all these milk products and then heavy sweets which
Okay.
you indulge in, and then don't binge on, okay, in between eating. and more of chocolates. These all things we need to avoid, and
Mhm.
have a proper meal, proper breakfast, lunch, and dinner. Timing is very important. Try to have early dinner, so that is before 7 o'clock. So, and make the dinner the lightest meal, and your main meal should be the lunch.
Oh,
So, we all do the vice versa,
the other way around.
Yeah. So you can go on intermittent fasting as well in Ayurveda. If you have a kapha type of body, you can go for that. So that itself helps you to lose weight and to have the proper digestion. And the quantity and quality of food matters here.
Right, right.
Yeah. So the quantity, what we say is half of your stomach should be the food, one fourth should be the water, one fourth it should be empty. To have a space, to for a good digestion. That
Right,
has to be followed.
right,
Apart from that, you need to exercise, okay?
right. Okay.
And for your bone health, for your weight loss, both.
Right, right.
Either you do a 45 minutes of walk,
Mm-hmm.
nature walk is also fine, or if
Mm-hmm.
you're following up with this yoga, then do Surya Namaskaras and do other asanas like, butterfly pose, Paschimottanasana, Janushirshasana, all these help to balance your, usually we put on the stomach and waist areas. More of weight gain is there because of the hormonal imbalance.
Mm-hmm.
We need to do the poses which help to
Right,
manage this area. So that
right.
we need to do. And always I advise everyone to have a daily detox. Just have a lemon honey water in the morning, and
Mm-hmm.
then once a week you try to be doing a fast, which helps you.
Okay.
It may be on juices, or if you can't control your hunger,
Mm-hmm.
then you can have some salads.
Right.
This helps you.
I think this is the most difficult answer probably we all have heard, I guess, of the show. Because I think this discipline has to be probably that
Yeah,
it implemented in our life just to have a healthy, the life to lead. So, but yeah, but it's an amazing. Thank you. I really think that we all should at least follow some of it, and to begin with, and then the rest will follow if we feel the results. So I think that's really great. But another one, that challenging question about the menopause, even though, like, we have heard that the risk factor is the breast cancer. So even though the menopausal, it does not directly cause the risk or associated with the risk of breast cancer. But it is true that early menstruation or the late menopauses that can increase the risk of excuse me, breast cancer. Is that true?
yeah. There are researchers, and there are when we take a history when there is a breast cancer patients.
Hmm.
We other than this, we have so many other conditions. Nulliparous women who haven't given birth to a child, and after birth who has not fed their child.
Hmm.
Breastfeeding is not done. Apart from that, multiparous women having lot of children, they all are at the risk of having breast cancer or the cervical cancer. So this here what happens is there is a lot of hormonal surge happening. When you do the breastfeeding, there is change in the breast, right? So the hormonal changes happen. But when you don't have a baby, also you have the more risk to have breast cancer, and also the family history matters,
Hmm.
right? So that is all there. That's the
That is the one that. So, what about the, like? I know that a lot of us are very scared to do any strenuous activities or the, resistance exercises as we go a little older, and also have, that the scare of the osteoporosis. The bones are going to become weak, brittle, and then we should not do it. So, does menopause has a severe effect on it, or is there any way we can avoid it through Ayurveda?
See, as we age, the bone density comes down after the menopause drastically. Until we have female hormones, it is taken care.
Taken care of. Right, right. The
Okay.
estrogen
So
level
when,
depletes at what
yeah,
you
estrogen
mentioned. Right.
levels when starts depleting, when it starts coming down, so
Mm-hmm.
then your bone density starts,
Mm-hmm.
it starts losing the bone density. What always I tell all my patients is, even though you didn't do any exercise before, but take up some kind of exercise at this time to
Mm-hmm.
maintain your bone
Mm-hmm.
health, along with managing of calcium and magnesium in your
Manage. Right.
yeah,
Right.
supplements or in your diet. Include such food, because uh, I have seen many women after the menopause, they don't take any supplements of this kind.
Okay.
So this is required, and they need to watch out their vitamin D levels as well, because if the lower the vitamin D, then the calcium absorption doesn't happen properly. So you need to have a proper level of vitamin D, at least 40 to 45 after the menopause, and try to include the supplements of calcium. If not, in the healthy way, you need to include dietary herbs, like, as I said, drumsticks,
Mm-hmm.
sesame. You can include nuts, you can include leafy vegetables like kale, palak, all those things,
Mm-hmm.
spinach and berries. All these things will help to maintain your bone health.
Right.
Apart from that, you can have you can do the strength training or weight bearing exercises
Mm-hmm.
with a proper trainer.
Right.
What I say,
Right.
it has to be done.
Right.
Apart
Right.
from osteoporosis, after the menopause is the next complication or next red alert. What we need to be aware of is cardiovascular diseases as our cholesterol starts building up.
Right.
So do regular checkups for your lipid profiles, do regular ECGs.
Right.
All this is required postmenopausal. And
Right.
suppose if you have a history of PCOD earlier, then you need to manage, you need to check your diabetic level, also CVDs. That is very, very important in postmenopausal women.
Right. As a matter of fact, we do have a question from a viewer. So it says that do hormonal changes associated with the menopause that also can cause severe insomnia? And also, she says that can PCOS be completely cured with Ayurvedic medicines?
Uh, yeah, I will address her first question. Yes,
Okay.
hormonal imbalances causes insomnia.
Mhm.
So in this case, we have to, identify her what kind of hormonal imbalance she is going through according to Ayurveda. If it is a Vata type of thing, then she need to undergo Shirodhara and Abhyangas regularly, and
Mhm.
she can take some herbal supports for the inducing of good sleep. Okay, like Brahmi, Ashwagandha, these can help her. But always it's better to consult an Ayurveda doctor
Mhm.
and then go for the medications or any herbs, right? And apart from that, she has to slow down her activities, and she has to concentrate on mindfulness and do meditations and do the grounding kind of exercises. So
Okay.
that may help her for the insomnia. And the second question is polycystic ovarian disease.
Mhm.
Yes, we do help in Ayurveda for a polycystic ovarian disease in different levels of a woman,
Mhm.
right from the menarche and during the fertility period, they have issues conceiving. So we have Ayurveda treatments for that. And main thing is, PCOS is not a single disease; it's a
Right.
cluster of syndromes.
Sure.
So there is an HPO axis imbalance, and there is an insulin resistance. Then there is a FSH-LH imbalance. Ratio is impaired, and they don't ovulate. All these things can be corrected with Ayurveda, with herbs, lifestyle correction, as well as yoga.
Mhm.
We have treated many patients, so we can be done, can be managed.
Okay. So, and let me address another question from, and I say, like, I hope this answered your question, Mukta. So hopefully that you got what you were looking for, and we will also give, in case if you want to reach out, so please do email me, and then I will give you more information as well. So this one is from Chandana. So she said, like, how does one work around Vata and Pitta dosha? Any suggestions to balance it?
Yeah, so I take her Vata dosha.
Okay.
So Vata, as I said, the quality of Vata is moving and it is dry, light, right?
Mm-hmm.
So
Mm-hmm.
the same way the symptoms in your body will be like that. So you will have all over the mind, you will be having a lot of thoughts, and then there is a dryness in the skin, dryness in the hair, all the symptoms will appear. So the best thing is doing self-abhyanga, as I said. Apart from that, including healthy nuts, good fat in your diet
Mm-hmm.
plays an important role. So you can add almonds, you can add walnuts, you can add sunflower seeds, you
Mm-hmm.
can add sesame seeds in your diet. You can soak and have them as the prana increases, because as I said, dry fruits may increase vata. So that is why there is a healthy fat, but when you soak in the water and
Mm-hmm.
have it soak overnight, the prana level in that will increase. So it is better to have the nuts, as well as you can, if you consult your Ayurveda doctor, they
Mm-hmm.
may prescribe you some herbs. As I said, ashwagandha also will help you. And if you have pitta type of this thing, then you need to stop having hot, spicy food, even though you like such kind of food,
Mm-hmm.
and stop doing fastings. Don't keep your stomach empty for a longer period. You get very angry when you're hungry. The
That's it.
advertisement of that chocolate suits for
Right.
pizza people.
Right.
Hmm.
Right. Right. So yeah,
And that is the thing.
this is really a great informative the session that you helped us with answer many questions and the issues. So before we close down, so what is your closing remarks? So just say something to our audience that how they can take a better care through Ayurveda, and not just the menopause, but in overall health, especially women going through so many of these different phases of life, especially the emotional health, which you are specialized in. So, please give us some light on it.
Yeah. As a woman, we play a important uh, role in the society. We are the creators, what I say. So
Yes.
whole of the society's health depends on the woman health, right? So as a woman, we need to take care of our health, prioritize ourselves, even though you didn't do during the active period, at least during the menopause, concentrate on your health. And what I say always is, it's okay to slow down, it's okay to take a break and concentrate on yourself, what's happening with you.
Mhm.
And even if you didn't get time, many women don't get time during their active period taking care of the family. If you have any hobbies to keep your psychological health and to balance sympathetic and parasympathetic nervous
Right.
surge, what
Mhm.
I suggest is always take up a hobby,
Mhm.
any creative hobby, whether it is painting, whether it is dancing,
Mhm.
indulge in those things. Co- Keep up your dreams, what you wanted to do when you were young. Try to do those things in your menopausal age.
Mhm.
And always, I tell all my patients, please take care of your uh, osteoporotic bone health. Don't get into osteoporosis.
Right.
So always remember to manage your vitamin D, calcium. Take your supplements regularly. Don't
Mhm.
neglect yourself.
Mhm.
Try to have a proper sleep and
Mhm.
proper nutritious food. First, you. take care of your health, then you can take care of your whole family as
Right.
well as the whole society.
Right.
So it's always to age gracefully. We need to give up some time for ourselves. Do the spiritual practices if you haven't done. Do meditations. Do mindful eating. Do mindful uh, activities in your life. So
Right.
it will be very smooth sail through the menopause. What I feel.
Well, thank you so much for joining, and Dr. Mamta, for all the expert advice and sharing your valuable time with us today to give so much of a valuable information. And I hope today's discussion was informative as well as helpful to many of you that who are looking for some of the answers of this. And I would like to, thank all of you. Also, join my sincere thanks actually to all my audience for tuning in and all the support that you have given so far. And so please do keep watching, and don't forget to join me back on the next episode with another very interesting topic that I'm going to bring, especially with the younger one, and your favorite guest. So take care, stay safe, and we'll see you next time. Thank you again.
Thank you.